81. The nurse should assess for anxiety in MI patients. True or false? Answer: true. Rationale: anxiety is common in MI due to pain and fear, increasing myocardial oxygen demand, requiring assessment per AHA clinical evaluation. 82. All MI patients require statins regardless of cholesterol levels. True or false? Answer: true. Rationale: statins are recommended for all MI patients for plaque stabilization and secondary prevention, regardless of baseline LDL, per AHA guidelines. 83. The nurse should teach MI patients to monitor their blood pressure regularly. True or false? Answer: true. Rationale: regular blood pressure monitoring helps manage hypertension, a key MI risk factor, per AHA patient education guidelines. 84. MI pain is always relieved by nitroglycerin. True or false? Answer: false. Rationale: MI pain may not be fully relieved by nitroglycerin, unlike angina, due to ongoing necrosis, requiring further intervention, per AHA clinical manifestations. 85. The nurse should assess for peripheral edema in MI patients. True or false? Answer: true. Rationale: peripheral edema may indicate right heart failure or biventricular dysfunction post-MI, requiring assessment per AHA clinical evaluation. 86. MI can cause atrial fibrillation as a complication. True or false? Answer: true. Rationale: myocardial ischemia can disrupt atrial conduction, causing atrial fibrillation post-MI, per AHA complications. 87. The nurse should administer oxygen to MI patients with chest pain. True or false? Answer: false. Rationale: oxygen is indicated only for MI patients with hypoxemia, SpO2 less than 90%, not routinely for chest pain, per AHA 2020 guidelines. 88. The nurse should teach MI patients to follow a Mediterranean diet. True or false? Answer: true. Rationale: the Mediterranean diet, rich in healthy fats and low in saturated fats, reduces MI recurrence risk, per AHA dietary guidelines. 89. MI can cause cardiomegaly on chest X-ray. True or false? Answer: true. Rationale: chronic ventricular remodeling post-MI can lead to cardiomegaly, seen on chest X-ray, per AHA imaging findings. 90. The nurse should administer thrombolytics to MI patients with recent surgery. True or false? Answer: false. Rationale: recent surgery is a contraindication to thrombolytics due to bleeding risk, requiring PCI or medical management, per AHA reperfusion contraindications. 91. The nurse should assess for tachycardia in MI patients. True or false? Answer: true. Rationale: tachycardia is common in MI due to pain, anxiety, or low cardiac output, requiring assessment, per AHA clinical evaluation. 92. All MI patients experience Q waves on ECG. True or false? Answer: false. Rationale: Q waves indicate prior MI but are not present in all cases, especially in STEMI or early STEMI, per AHA ECG criteria. 93. The nurse should teach MI patients to exercise regularly post-recovery. True or false? Answer: true. Rationale: regular, supervised exercise improves cardiovascular fitness and reduces MI recurrence risk, per AHA cardiac rehabilitation guidelines. 94. MI can cause transient ischemic changes on ECG. True or false? Answer: true. Rationale: transient ST segment or T-wave changes can occur in MI, reflecting reversible ischemia, per AHA ECG findings. 95. The nurse should monitor for hypokalemia post-MI. True or false? Answer: true. Rationale: hypokalemia can occur post-MI due to diuretics or stress response, increasing arrhythmia risk, per AHA metabolic guidelines. 96. The nurse should administer AC inhibitors to MI patients with hypotension. True or false? Answer: false. Rationale: AC inhibitors are contraindicated in hypotension, systolic BP less than 100 millimeters of mercury, due to risk of worsening perfusion, per AHA pharmacologic contraindications. 97. MI can cause syncope as a presenting symptom. True or false? Answer: true. Rationale: Syncope can occur in MI due to arrhythmias or reduced cardiac output, especially in the elderly, per AHA clinical manifestations. 98. The nurse should teach MI patients to avoid excessive alcohol intake. True or false? Answer: true rationale. Excessive alcohol can increase blood pressure and triglycerides, raising MI risk, per AHA lifestyle guidelines. 99. The nurse should assess for murmurs in MI patients. True or false? Answer: true rationale. New murmurs may indicate mitral regurgitation or ventricular septal rupture post-MI, requiring assessment, per AHA clinical evaluation. 100. MI can be prevented by controlling modifiable risk factors. True or false? Answer: true rationale. Controlling modifiable risk factors like hypertension, smoking, and obesity significantly reduces MI risk, per AHA prevention guidelines. 101. The nurse should teach MI patients to report chest pain lasting more than 5 minutes. True or false? Answer: true rationale. Chest pain lasting over 5 minutes may indicate recurrent ischemia or reinfarction, requiring immediate reporting and medical evaluation, per AHA patient education guidelines. 102. MI can only occur in patients over 50 years old. True or false? Answer: false rationale. MI can occur in younger patients, especially with risk factors like smoking, diabetes, or genetic predisposition, per AHA epidemiology data. 103. The nurse should monitor for signs of heart failure post-MI. True or false? Answer: true rationale. Heart failure is a common post-MI complication due to left ventricular dysfunction, requiring monitoring for symptoms like dyspnea and edema, per AHA complications guidelines. 104. Nitroglycerin is administered intravenously for all MI patients. True or false? Answer: false rationale. Intravenous nitroglycerin is used for persistent ischemia or heart failure in MI, but sublingual nitroglycerin is standard for initial chest pain relief, per AHA protocols. 105. An elevated heart rate increases myocardial oxygen demand in MI. True or false? Answer: true rationale. Tachycardia increases myocardial oxygen demand, worsening ischemia in MI, necessitating interventions like beta blockers, per AHA pathophysiology. 106. The nurse should assess for epigastric pain in MI patients. True or false? Answer: true rationale. Epigastric pain is an atypical MI symptom, especially in women and the elderly, requiring assessment, per AHA clinical manifestations. 107. All MI patients require a pacemaker post-event. True or false? Answer: false rationale. Pacemakers are indicated only for specific post-MI complications like persistent bradycardia or heart block, not all patients, per AHA device guidelines. 108. The left coronary artery supplies the majority of the left ventricle. True or false? Answer: true rationale. The left coronary artery, via its branches LAD and circumflex, supplies most of the left ventricle, critical for cardiac function, per coronary anatomy. 109. The nurse should teach MI patients to manage stress to prevent recurrence. True or false? Answer: true rationale. Stress increases catecholamine release, raising MI risk. Stress management techniques are part of secondary prevention, per AHA lifestyle guidelines. 110. ST segment depression on an ECG indicates STEMI. True or false? Answer: false rationale. ST segment depression suggests STEMI or ischemia, while ST elevation indicates STEMI, per AHA ECG classification. 111. MI can cause ventricular tachycardia as a complication. True or false? Answer: true rationale. Ventricular tachycardia is a life-threatening post-MI arrhythmia due to myocardial irritability, requiring immediate intervention, per AHA complications. 112. Troponin levels are used to monitor MI treatment progress. True or false? Answer: false rationale. Troponin levels diagnose MI, but are not used to monitor treatment progress. Clinical symptoms and ECG changes guide therapy, per ACC biomarker standards. 113. The nurse should administer aspirin to MI patients with active gastrointestinal bleeding. True or false? Answer: false rationale. Aspirin is contraindicated in active gastrointestinal bleeding due to increased bleeding risk, requiring alternative antiplatelet therapy, per AHA contraindications. 114. Smoking cessation reduces MI risk within 1 year. True or false? Answer: true rationale. Smoking cessation significantly reduces MI risk within 1 to 2 years by decreasing thrombosis and atherosclerosis progression, per AHA prevention data. 115. The nurse should assess for fatigue in MI patients. True or false? Answer: true rationale. Fatigue is a common MI symptom, especially in women and the elderly, indicating reduced cardiac output, per AHA clinical manifestations. 116. MI always results in complete coronary artery occlusion. True or false? Answer: false rationale. MI can occur with partial occlusion or non-occlusive causes like coronary spasm or demand ischemia, per AHA pathophysiology. 117. The nurse should monitor for signs of thromboembolism post-MI. True or false? Answer: true rationale. Post-MI ventricular dysfunction or aneurysm can lead to thrombus formation and thromboembolism, requiring monitoring, per AHA complications. 118. All MI patients require immediate cardiac catheterization. True or false? Answer: false rationale. Cardiac catheterization is indicated for STEMI within 90 minutes or high-risk STEMI, not all MI patients, per AHA reperfusion guidelines. 119. The nurse should teach MI patients to maintain a low-fat diet. True or false? Answer: true rationale. A low-fat diet, particularly low in saturated fats, reduces atherosclerosis progression and MI recurrence risk, per AHA dietary guidelines. 120. Beta blockers are contraindicated in MI patients with heart failure. True or false? Answer: false rationale. Beta blockers are beneficial in MI patients with heart failure, e.g., carvedilol, improving outcomes, unless decompensated, per AHA pharmacologic guidelines.